Hi, everybody. My name is Amy Wilson. I am a clinical social worker. I've been a medical social worker for my entire career. For about the last 14 years, I've worked in various settings from hospice to critical care to inpatient, which now I'm working at the University of Minnesota, Health Fairview, Minneapolis. I work at the Center for Bleeding and Clotting Disorders with Dr. Mazeppa. I have been able to work with bleeding and clotting disorder patients for the last 6 years. And I want to thank Dr. Mazeppa and the USTMA for having me here today to talk about this topic that I think is so important to raise awareness about. So my hope for today is kind of start with some general terms about coping, chronic disease, mental health, and get into some more specific details around anxiety, depression, and trauma. My hope for today is to provide some awareness as well as some empowerment to all of you to better understand what mental health looks like, how it intersects with chronic disease, and then leave you maybe with a plan to have better self-care or try a different approach in your day-to-day life. Before I start, I also want to mention it is very normal when having conversations about anxiety, depression, or mental health symptoms to just suddenly start experiencing them. I say that because if you start feeling a little ramped up or a little sad, it's normal. Do what you need to do to take care of yourself, whether it's to stand up and stretch, go get some water, whatever you need. I just want to make sure that you know that is incredibly normal. So here are some general definitions. Chronic disease, something that is lifelong. And a rare disease is a condition that affects fewer than 200,000 people nationwide. It can be jarring enough to be diagnosed with a serious disease, such as cancer or diabetes. But as difficult as it is, there are many avenues to get information and to be able to connect with others. That's what makes TTP and other TMAs very different. For those of you that have learned you have an illness that is so rare, most people have never even heard of it. It lends to different complexities. I think since working within the rare disease space, the thing I most commonly hear is that people feel isolated, misunderstood, and alone. Dr. Mazeppa and I, a couple years ago, started doing a TTP support group at the University of Minnesota. Of course, because of COVID, we've been unable to continue at this time, but we definitely hope to bring it back when it's safe and we're able to do so. But at our very first meeting, we had kind of looked around and asked our attendees, I don't really remember, I think we had 8 or 9 attendees, if any of them had actually met anybody else with TTP, with technology and the way people are able to connect. I thought maybe somebody had, but the answer was no. Which was very powerful to hear and why I think it's so important to remind people of the power of connection and seeking out resources. So talking just generally about stress, it is something that all of us experience. Some factors in our jobs, our relationships, or our lifestyle are simply just prone to creating challenges. And a certain amount of stress is actually healthy. It can be a motivating factor. The reason I bring this up is I just encourage you all to think of a stressful time in your life and what tools that you use to navigate that stress, whether it was your support system, self-care, whatever that looks like. It can kind of help tee up things for our discussion throughout this next half hour, 45 minutes. So on the screen now, you'll see a couple definitions of what a crisis is. Words that stick out to me are intentional or intense and emotionally significant. Just wondering how applicable this feels to all of you. I mean, caregivers too, you've watched your loved one kind of go through a hospitalization and plasma exchange and all of the after effects. I imagine some of it still feels very intense and emotionally significant. So it is normal to feel whatever it is that you felt at the time of diagnosis, as you recovered physically from your diagnosis. Just let that sink in for a minute. A rare disease diagnosis is even more jarring as it's hard to find connection from peers or a care team that understands. I was able to tune in kind of to the last talk for a little bit, and I liked what was said about the hot grease on your arm. You wipe it off, but the effect stays for quite some time, and that fits perfectly within this. So to start talking about just the emotional dimensions of chronic disease, the number of people with chronic disease is growing. People are living longer, they're surviving situations they might not have survived in the past. And as a result, people are paying more attention. Physicians, providers, nurses, they're just wanting to have a better understanding about their patients and what they're going through. If you look back over history, the medical model is a set of procedures which all doctors are trained based on a disease process. Physicians are trained to assess and treat symptoms based on what they know of physiology. The physicians here today, and I'm sure many others that you've encountered over time, are, of course, naturally compassionate and wanting to understand and help all dimensions of their patient. But that's where social work comes in, or psychology, or whoever might be embedded in your clinic. I'm also trained to assess and treat, but in a different way. I look at psychological impacts, cultural and social aspects, help with crisis management to promote coping and navigate systems. So together, along with your physician, we try to, impact from a whole person model. And also just want to make mention that there is also more awareness that a lot of people after a diagnosis of any kind, oftentimes will go through a grieving process before they're able to take on the process of adapting and adjusting their day-to-day life, and that families also do tend to be more depressed or anxious. Some of the emotional costs of treatment that are becoming more and more aware in people's awareness is just the cost of lifestyle changes, the impact that has had on all of you as you've worked to shuffle things around and create your new normal, whether it's juggling appointments, dealing with treatment side effects. It's just important to recognize how this impacts mental health overall. So I just want to again state you aren't alone in how you're feeling. I kind of compiled some articles surveying individuals' experiences across other chronic diseases and how some of these events just create stress in your life. With shock and emotional distress, many people are still grieving losses, processing shame, fear, or guilt. The uncertainty of why does this happen, the potential for reoccurrence, how all of those feelings then impact a behavioral change. That could be avoiding situations you once thought were safe because you're anxious, adjusting your aspirations or your lifestyle. For some, it's just a change in focus and what do I want out of my life? You had an life-threatening experience. That's pretty heavy stuff. Some people might find themselves living more spontaneously, living in the moment, feeling more cautious or overwhelmed on a whole. And sometimes medical events also cause a shift in roles, whether it's children caring for parents sooner than they thought, or young adults living differently from their peers. And, all while trying to figure out who they are as a person, they have this medical event thrown at them, and they have to deal with integrating that as well. For some, it creates a distrust in the medical system. I hear often about the diagnostic odyssey or the pathway that people have gone to an accurate diagnosis, potential for misdiagnosis, misunderstanding from physicians who just don't know what this disease is. It can also be a longer-term challenge, I know, for people locating physicians that know how to treat your diagnosis that are closer to your home. If you have a medical emergency, you want to go to the nearest emergency department a lot of times, but that can also provoke anxiety if that's a small rural hospital, just for example. So after saying all that, I just want to touch on the autonomic nervous system. This part of the nervous system is responsible for control of bodily functions that aren't consciously directed. I just want to point out, the sympathetic nervous system activates your fight or flight response. The parasympathetic nervous system's job is to relax you. For example, you get an adrenaline rush and somehow your body just re-regulates you. I just want to point out that traumatic events, including medical events, push the nervous system outside of its ability to regulate yourself. It can result in anxiety, anger, depression, feeling panic, or feeling overwhelmed or overstimulated. I just want to say, mental health symptoms aren't a flaw of self. They can be a reflection of your body reacting and doing its job while it's dysregulated. And there are ways to learn how to better manage that, if that is indeed what, your physicians determine you could be experiencing or lending to your whole medical picture. So when considering a medical crisis, there's a brief list here on the slides, but symptoms are indeed pronounced in medical events that pose a significant threat to life and well-being. I say that very intentionally, knowing the group that I'm talking to. Many of you survived a life-threatening event, hospitalization, plasma exchange. You're now dealing with the lifestyle impact of that. We hear often about challenges with concentration, memory, and endurance, all in the midst of having some strong emotional reactions, such as sadness, uncertainty, a change of quality of life, and a fear of relapse. I just want to say that, again, this is a normal response. When we do better, when we consider how you've responded, and it's when it becomes prolonged and impacts your day-to-day, it's when it becomes even more important to intentionally talk about coping. So there are emotional dimensions that go along with chronic disease. Again, I know this is a little bit repetitive of what I've already said, but why does this happen? The adjustment period that you're going through as you kind of make meaning out of what happened to you while grieving changes and things that you weren't expecting that might impact your future. Why is this important? It absolutely can, develop into persistent emotional distress. And anxiety or depression can impact your ability to follow your treatment plan. It can impact your it can heighten your experience of pain. And I guess I just encourage you to take a second, think back to your diagnosis or your first hospitalization or your loved one's hospitalization. My guess is that heavy mental work started right then and there. People often go into survival mode as they try to incorporate complicated medical information and putting their emotions aside or not even really knowing what's normal. My guess is as time went on, you became more and more aware of that impact. Maybe don't necessarily have a name for it or fully understand it, but we'll go into more detail about that later. I just want to point out it's important to pay attention to changes, no matter how subtle they might seem to you. So here's a basic definition of coping. It's kind of you're dealing with something in your environment or you're dealing with something within yourself. What's different when coping with a chronic condition is, when you have like a flu or a bronchitis, you're able to tell yourself, okay, I'm going to feel better and be back to normal in a short period of time. This isn't necessarily true with chronic illness, let alone a rare disease that people are still trying to understand. And long-lasting effects may not go away, and it can disrupt your life in a number of ways. Healthcare professionals are absolutely paying more attention to this. Even over the span of my 14-year career, which in the long run really isn't that long, but it's enough to have definitely noticed a trend as far as physicians and providers talking about this more and it, research being done more in these domains, which is really important. We still have a long way to go, but we definitely are doing a lot better than we were a handful of years ago. So as we think about coping, there are two general types of coping. Emotion-focused coping alters how you experience the stressor. Problem-focused coping is when you find a way to work with the stressor itself. So to talk about emotion-focused coping first, you'll see I kind of put some buckets of different types and examples below, but just quickly, some people will engage in positive emotions, whether it's journaling or praying or meditating. Overindulging is also a form of emotion-focused coping. That might be overindulging in food, substances like alcohol or drugs. So again, not all coping is necessarily healthy, but that is a strategy that some people find themselves doing. Finding meaning or benefit. I've had patients and families tell me as a result, their bond with their sister became stronger, or with their children, or whoever that might be. Engaging in an emotional approach. I guess the best descriptor I have for that is just if you've ever needed to have a good cry and you've actually just done it and let yourself do that. And then accommodating the stressors, kind of doing the best you can with what you have, and accepting what you can't change, which way easier said than done, right? Some other examples are thought suppression. If you don't think about it, does it fix the problem? No, but it reduces your stress in that moment by not thinking about it. Some people cope with humor. It's kind of hard to be stressed if you're laughing. And for others, it comes out as aggression. It's kind of you're displacing your stress from the actual source, and it might come out as frustration or snapping at your family or even road rage or something like that. I just want to say emotion-focused coping is actually quite valuable. Shifting how we experience potential stressors in our lives can then reduce negative impact. The secondary benefit is that it can help cut down on chronic stress and give your body a chance to recover from what might otherwise be considered too high levels of stress. So it's important to kind of engage in and try to practice some of these strategies. Problem-focused coping is much more practical. You try to impact the problem or situation that's causing stress. And to be honest, that's something you're all doing exactly right now in this moment. You're attending this education day, you're seeking out information, you're empowering yourself with education. Some other strategies that fall in this bucket are just knowing your plan if you feel symptoms and communicating that to family or friends. Work closely with your physician or your nurse to have a plan of action. It's the opposite of avoidance and also the opposite of catastrophizing, which I know can be very easy to do. It's where you try to focus on staying logical by looking at facts. So these are some coping strategies that aren't necessarily illness specific, but if you think of a time when you had prior stress and look at all of these strategies and think about what you've incorporated, it might give you a clue to what could help you now if you feel like you're struggling. The things that we hear about healthy exercise and diet and adequate sleep, I know it sounds so basic, but it's so powerful. I like to point out the practice meditation or mindfulness techniques, if that's something you find helpful. The reason it's good to practice is that you increase your competency and skills. So if it's next time you're going to a doctor's appointment, you're feeling really stressed out or ramped up, or your heart's beating fast, if you're able to employ some of the skills that you've perfected, such as deep breathing or meditation, you might be more quickly able to calm yourself down. Another strategy I like to mention is to take your own advice. If you ask yourself, if a friend or a family member came to you with the same worry you're experiencing, what might you tell them? Imagining your situation from the outside can often provide a perspective and fresh ideas if you're kind of stuck in your thought worry cycle. I also want to point out too, the last one, keeping activities that bring you joy. I know when I'm stressed, I'm guilty of letting go of the first things that I think are extras because I'm so stressed out and focusing on something else. I just know it's better to kind of engage in some of those positive emotions by doing things that bring you joy. So here are some coping strategies specific to living with a chronic illness. It's kind of a mix of emotion-focused and problem-focused. As you all know, living with a chronic illness can be stressful. It's important to just learn as much as you can about your illness and treatment needs. Be proactive, have a plan, lead a healthy lifestyle, and make time for activities and relationships that leave you feeling happy and supported. And it's okay to avoid people and things that stress you out. It's just really important to make your health and well-being a priority. So as you look to practice some of those skills or come up with your own mental health plan, it can also help you prevent an increase in stress in the future. It better equips your mind and body to handle stress as it comes up. I know it's not always possible to remove future stressors. I mean, it's straight up not possible, I guess I should say. But take control over what you can control, and focus on overall wellness. Avoid taking on more tasks than you have time to do. It can just lead to being overwhelmed. It's okay to plan day by day sometimes even hour by hour if you're particularly overwhelmed. I also want to encourage paying attention to yourself when you're in certain environments. I know for some people they've said, yeah, I realize I get much more ramped up and anxious for a day if I go to the mall on a Saturday afternoon and there's parents and kids and it's loud and very crowded. It's just take stock of what kind of things stress you out and do what you can to avoid them. Simple things like that really can go a long way. So now we're going to turn to talking a little more specifically about mental health disorders. Mental health disorders are medical conditions that disrupt a person's thinking, feeling, mood, ability to relate to others, as well as their daily functioning, such as going to work or raising a family. Signs can be very difficult to see, and subtle mood changes can happen over time and might be hard for you to notice. I also just want to say Mental Health America, as of this year for 2020, says that 19% of adults are experiencing a mental illness. And that's equivalent to 47 million Americans. Some people might experience mental health symptoms that aren't necessarily a diagnosable disorder. It's a spectrum of things, and we'll talk more specifically about trauma, anxiety, and depression today. And again, we'll run through some symptoms and some indicators, but I'm not going through these with the intent of diagnosing anybody or anything with this. I just want to provide some more information and perspective. So to start with depression, again, it affects how you think, feel, and act. It does impact a third or more of people with chronic disease. The Oklahoma TTP registry has documented that survivors do have an increased prevalence of depression in comparison to the general population. Some commonly initially reported symptoms are sadness, low energy, or a lack of interest in daily activities. Sadness is very natural and oftentimes a brief response to negative life circumstances. When you think about depression, it's more persistent. It's not like just having the blues. It's often hard to snap out of and generally lasts more than a couple of weeks pretty consistently. Depression can also be caused by, biological factors, whether it's the chemicals in your brain and what levels you have. Genetics, there is a thought that it can be partially inherited, or an environmental factor like trauma, like something that you all might have experienced as far as your initial diagnosis and hospitalization went. Again, here are some symptoms. I also want to point out, people that are chronically ill have a high likelihood to experience somatic symptoms. It might be pain, fatigue, loss of interest in sexual activity. It's really hard for clinicians to figure out, is this medical? Is this depression? Is this both? Some of it's subjective and objective. Kind of relating back to some of the things said at the end of the last session about being your own advocate and just asking those questions and talking with your primary care provider about this is your best first step. Again, depression affects your ability to carry on with daily life and to enjoy things. Some questions you could ask yourself if you're wondering if you have depression are, have you lost interest in activities that used to bring you joy? Has life lost so much meaning that you're starting to feel empty? Do you lack motivation for change, or do you just feel there's not much that you could actually do to improve your life? It's important as well to take note in your general habits. Sleeping or eating too much or too little can actually also be a sign of depression, as well as engaging in high risk behavior, like excessive drinking, drug abuse, unsafe sex, or cutting. Those are all examples of potential behaviors someone might engage in to provide temporary relief from some really intense emotional pain. Persistent fatigue, another challenging symptom because it could be related to your medical diagnosis, but it also could be a sign of a mental health condition. And mood swings, if they're not typical for you, it could also be a sign of depression. So now touching on post-traumatic stress disorder. It is a mental health disorder some people develop after experiencing or witnessing a life-threatening trauma. Historically, it's been considered in individuals that have experienced war or rape or disaster or something like external. There's been more research recently that internal events are being recognized as something that can also cause post-traumatic stress or even stress symptoms. 4 to 8% of the general population will experience PTSD. There's research that shows it occurs 12 to 15% of survivors of acute medical events, heart attack, stroke, cancer. Some of these symptoms are intrusion symptoms, which are like nightmares or flashbacks of the original trauma. Avoidance symptoms, which are avoiding hospitals, missing appointments, canceling appointments, and as well, substance abuse kind of falls into that category too, where it might be considered emotional numbing. Some of the cognitive symptoms are challenges with memory, attention, planning, and problem solving. And then an example of alterations in arousal or activity, it'd be feeling hypervigilant, being unable to concentrate, irritable or aggressive or angry. So I brought those two up specifically first because I'd come across an article in Thrombosis Research that was published in 2017. Individuals use validated tools like the PHQ-9 and, well, I guess in this one, they use the Beck Depression Inventory and what's something called the PCL-5, which is assessing for post-traumatic stress disorder symptoms. So from that study, within TTP, 80% of individuals had at least mild depression symptoms, and 36.8 had severe symptoms. So depression symptoms are kind of scored on a continuum where you might be experiencing them mildly, moderately, or severely. And I thought this PTSD statistic was pretty eye-opening. 35% had a positive screen for post-traumatic stress disorder. And when they compared that to what happens just if that same screen were to be done in a general primary care population, it was 3.5%. I say all this with hope, again, to just bring awareness and normalize what you might be feeling, because other people with TTP are showing that they're, feeling that too. So now looking to touch on anxiety a little bit. Anxiety disorders are also another type of mental illness. Trauma and stress due to illness, stress buildup, those are all risk factors for developing anxiety. When we look at what makes an actual disorder, it's something, again, that severely interferes with somebody's life. It is an uncomfortable feeling of fear, uneasiness, or concern that something bad's going to happen. There's two general types of anxiety disorders. One is generalized anxiety disorder, which is when someone has months of ongoing physical symptoms that occur along with some of these symptoms on the slide, like worry and concentration and sleeping problems. Panic disorders can also develop, which are sudden fear and feelings of danger or impending doom. These disorders can be treated with medications and or counseling. Again, it's just asking, is your level of worry impacting your ability to enjoy life? That might indicate to you it's time to get some, talk with your primary care doctor, get some professional help. So now that I've run through all of that, I want to put this nervous system slide up again and just restate. traumatic events push the nervous system outside of its ability to regulate itself. For some people, their system might get stuck in the on position, and that person would be overstimulated, have a hard time calming themselves. This can result in anxiety, anger, restlessness, panic, and hyperactivity. You're kind of like in a ready to react mode more often than you maybe typically had been. For other people, the system gets stuck in the off mode, resulting in depression, disconnection, fatigue, and lethargy. There are specific interventions to help with mental health conditions and the nervous system in the way I just described it. It might be medication. There's significant research in mindfulness-based stress reduction, where you learn to coach your body to counteract the way that it might be dysregulated. Specific therapy interventions meant to help replace the memories that are specifically stressful for you personally. So there's things out there, and I just want to raise awareness that there's specific questions that you can ask. So common reasons to seek professional help. You can see the list over here, but I also think it's important, ask your loved ones. Ask them, what have they noticed about you? How long has this change been going on? It might help you understand if this is something you've been dealing with temporarily or if it has been long-term. I think it's always a good idea to take stock of how we're doing and become more aware of our own thoughts, feelings, and actions. And for the caregivers that are tuning in, I just say show support, stay open-minded, and be honest with your loved one with what you might be noticing. Encourage professional help. And then, of course, me as a social worker, I always say it can never hurt to ask someone if they've been thinking of harming themselves. I also want to add a statistic that the Depression and Bipolar Support Alliance says that up to 80% of people experience improvement in mental health symptoms within 4 to 6 weeks of starting, whether it's psychotherapy, support groups, medication, or a combination of these. So there is hope for relief, at least in some shift forward. And again, a good place to start is with your primary care physician. I just want to reiterate some coping strategies. These are all strategies you can employ now, ones that you don't necessarily need to talk to your doctor about or see a therapist about, but ones you can do right now, today. These are all involved a conscious and direct effort to approach your problems. I want to point out a few that I didn't say on the slides earlier, but the scheduling worry time, that can actually be very helpful if you are someone who's stuck in that worry thought kind of wheel where you feel like a hamster that you can't get off of it. Sometimes you can ask yourself, what evidence do I have? Schedule time to just let yourself worry for 15 minutes a day and then set it aside. Set an alarm. Sometimes that helps that worry not interfere with what you want to focus on for the rest of your day, whether it be work or kids or family or what have you. Reach out to your support system, spend time in nature, and of course, all the basic self-care things. My hope today is that this raised some awareness of what you might be experiencing and gave you an opportunity maybe to name something that you weren't sure what it was related to emotions, and that you'd be empowered to come up with a mental health plan for yourself. And so that's the end of my presentation. And if there's any questions, I'll certainly help answer them. Okay, let's see here. I do see one question here. I know, Claire, you're jumping on here in a second to help out with this, but I see a question that had come in earlier that asked, as a caregiver to a young adult diagnosed with TTP, I believe I've developed/have post-traumatic stress syndrome. Is it possible? And if so, will it ever go away? My answer is absolutely yes, it is possible. As a caregiver, you're experiencing that same level of shock to your system. It's just from the outside as opposed to being the person affected by the disorder and the condition. And will it ever go away? That's a really good question. I think there are ways to learn how to manage, however those stress symptoms are looking for you, to make them better so that you're less distressed. Whether that means that whether it's actually gone away, I don't know. I guess there's potential that you'll learn how to better manage it, and feel better about it in your day-to-day life. So I'd recommend trying to find a trauma-informed therapist as a place to start.
Amy, thanks for such a great talk. I think in our Ask the Hematologist session, I noticed a few questions came in about patients or maybe family members too who feel that their hematologist may not recognize or sort of understand some of these symptoms that come from the disease or potentially from coping with the disease. And I wonder if you could maybe speak to how patients can maybe more effectively raise concerns about the stress of chronic disease with their providers, and then potentially other actions they can take if some of the skills you mentioned today don't seem to be helping enough.
Yeah, absolutely. I think I'd kind of refer back to taking an honest reflection of yourself and pointing out things that have changed and bringing that forward to your physician. You're able to say kind of what your baseline is and then what you're struggling with now. I think that makes it a little bit more relatable and understandable in some ways. It also might help you feel more confident in how you're describing yourself because you're able to recognize what those differences are. A couple resources, I guess, too, if you feel like you're not getting the help you need from a mental or emotional standpoint. Again, I know we're always saying go to your primary care doctor, but so you might have the same kind of experience with them. I can put this information in the chat, or maybe I can give it to Claire to get out to everybody, but there are a couple tools that I'll refer patients to they're online, but it's where you can find a therapist kind of based on what your concerns are, what your insurance is, where you live. You can read bios about them ahead of time and see if, get an idea if you think you might work well with them. I know it can be really intimidating taking that first step to just kind of cold call somebody and try to see them and then talk about your feelings. That can be really overwhelming. So these tools can be really helpful for something you can do on your own time and make a more informed decision about getting mental health care.
Yeah, I do. Oh, go ahead, Claire.
Oh, I was just gonna say, Amy, that would be great. We can actually put them on our website at USTMAconsortium.com, and that way patients can have access to them easily and whenever they're looking for it.
Okay. Yeah, and they are backed by a national organization for the therapist tools. So yeah, I'll send that to you and then you can get up on the website.
And I think potentially, Amy, one question patients might have about seeing a therapist is, what exactly should they get out of seeing a therapist? What are the ways that someone could help them deal with these? Because I think people have a good understanding about, say, what going to a physician might involve blood tests or medical treatments, but I think trying to understand how a psychologist or a licensed therapist might help them is a little less clear to most people. And so what sorts of skills or what sorts of strategies do you think they could expect to learn about or benefit from if they see a therapist?
Sure. Yeah, that's a really good question. So therapists will usually start a session by taking a thorough history. Of course, they want to take medical conditions into account. They want to try to understand, if you have a trauma history or a substance use history, an abuse history, as that all kind of feeds into how our personalities develop and what kind of help we might most benefit from in that moment. Together, that you'll kind of determine what are your most distressing symptoms at that time, and that'll be a place to start. Some therapists might just help you with what's going on in the here and now so that you can better cope with your day-to-day. Others might take the approach of dealing with trying to uncover, childhood traumas or issues that might have resulted in development of a personality in a way that you just want it to be different. So they really seek to partner with you to help find out, what are you struggling with now? And how can we make that feel better so you're better empowered to be the person you want to be? I think as it relates specifically to chronic illness, it's a lot of those, feeling ramped up, getting angry, getting sad. How do we best come up with strategies to make ourselves better able to manage those strong emotions?
And that kind of leads us to one of the questions in the chat here. What's the best way to keep from getting angry when someone in this example, like, compares an endometriosis diagnosis to a TTP diagnosis? So what's the best way to help regulate those emotions, or some tips on keeping from getting angry too quickly?
Oh, sure. That sounds completely frustrating. I'm sure I would feel the same way if that was me and someone tried to make that comparison. Sometimes I will coach myself, even if I feel that I'm getting angry, to just count to 5 before I say anything. I'll try to self-regulate by taking deep breaths to calm myself down. And I say this because I know I haven't met you, and I know I have very little information other than how do we help with anger in that moment. And it's kind of taking a break, doing what you can to kind of squash down whatever it is that has ramped up, which can help a lot by taking deep breaths. A strategy I like to use it's called box breathing. It's pretty simple, but you inhale and count to 4 while you're inhaling, hold it for 4, exhale for a count of 4, and then hold that for 4 again. So it's kind of like a 4x4 box, but that can often help kind of calm somebody down when they're really kind of feeling ramped up. It's also an easy thing to teach to kids too, who might be kind of dysregulated.
And Amy, from the perspective of providers, how do you think that providers might be more attuned to these sorts of, I think particularly notable that the negative coping strategies our patients might be taking on, and to redirect them to more constructive coping? How do you think the best way to sort of broach this with patients might be? And it sounds like patients, if they can recognize they're maybe choosing some negative coping strategies after listening to your talk, that'd be great. But it sounds like we could be doing more to recognizing how our patients are trying to cope, and direct them to more positive coping strategies.
Yeah, that's a good question too. I think for some people, I think it's that connection of substance use or misuse or abuse, whatever word you choose to use, can be related to emotional numbing. And I think that's not always in people's awareness that that's what it could be. I know specialty care clinics sometimes operate a little bit differently, but even asking how many days a week do you have alcohol? How many drinks do you have at a time? And then just saying a statement of, sometimes these can be connected. It's not necessarily here to judge how somebody's coping or what that looks like, but even just asking the question and then putting out it from a standpoint of, I'm here to just educate you that this is a reality. You could also employ using PHQ-9s to scan, or GAD-7s, which look at anxiety and depression, or even go as far as, if you wanted to, use the PCL5 in clinic to look at depression or post-traumatic stress symptoms. They're actually all tools people can find online just by Googling as well. They all generate a score that kind of indicates you could qualify for having this diagnosis. So it's meant more as a screen, not as something definitive, but it's helpful information, and they're validated tools that also can be tracked over time. You can put them in the electronic medical record. Even if you were curious if someone's functioning better a year from now, the scores could be right there.
Great.
So.
Well, that was a great talk, Amy. I think helpful to the physicians listening, and to our patients and loved ones. So thanks so much for your time today.
Yeah, that was really, really great. Thank you.
Good. Thank you for having me. I appreciate the opportunity.
Great, thanks, Amy, and hopefully next year we can do this in person and have more personal interaction with everyone.
Yeah, that'd be great. I know on my end, I'm like, it's so hard, especially as a social worker. I'm like, I can't read how this information's coming across. So yeah, well, I hope the rest of the meeting goes well.
Thanks very much.
Yeah, thank you.